Greetings and welcome to EHA Unplugged, the official podcast channel of the European Hematology Association EHA. This is a special Lighting the Flame edition where we talk to some of our promising and active members in the hematology community. Our guests in this podcast series have volunteered their time to attend and facilitate the Lighting the Flame program where they mentor young trainees and medical students in their field of hematology. In this podcast series, they talk about their experiences in their field and give advice to those who are interested in becoming a hematologist. So sit back and enjoy the podcast. Disclaimer: this interview was recorded outdoors during the Lighting the Flame workshop in Romania, in a wonderful location next to the fields and forest. Therefore, you may hear some cricket noises in the background.
Hello, my name is Konstanze Döhner. I'm a hematologist working at the University Hospital in Ulm, Germany.
Hello, I am Jorge Sierra, I'm a hematologist at the Hospital Sant in Barcelona, in Spain.
So it's really nice to have you for the interview today. So Professor Sierra, you are an expert in hematology and you are an expert also in myeloma, not only in acute myeloid leukemia. And today I would like to discuss with you myeloma, and maybe you can give a brief introduction about myeloma.
Well, myeloma is a plasma cell disorder which is characterized by the clonal production of plasma cells. And this leads to the production of a core or a part of the immunoglobulins. And we have two problems for having myeloma. One is that plasma cells produce cytokines that stimulate osteoclasts and produce bone lesions. And on the other hand, the abnormal immunoglobulin, which is producing a very high amount, may produce toxicity in different organs, mainly in the kidney. So it's very common to have myeloma patients with renal insufficiency. But we also have other abnormalities. So the replacement of normal bone marrow by myeloma cells leads to anemia, and again the higher activity of osteoclasts produces hypercalcemia, which manifests different clinical features, and of course the lesions that may be severe in these patients.
So what is the typical feature? Why do patients come into the clinic, and what is the typical symptoms they have when they come with a suspicion to myeloma?
Well, the typical symptoms are, on one hand, weakness due to anemia, and also bone pain as a reflection of the marrow infiltration by clonal neoplastic plasma cells. Sometimes they also come with some neurological symptoms like somnolence due to the hypercalcemia, or sometimes they have other clinical features. But the most common are those related with anemia and bone marrow infiltration and bone pain, and sometimes these bone symptoms may be severe due to osteolytic lesions and spontaneous fractures.
So when you look at multiple myeloma as a disease, what is the fascinating aspect? If you look at it, multiple myeloma in comparison to other diseases we are treating?
Well, you have symptoms from several organs, from the kidney, of the bone, of the hematopoietic system, and so you have a variety of clinical symptoms on one hand. And I would say what is more fascinating has been So the change in prognosis of these patients thanks to the development of many novel agents that have changed the landscape of treatment of myeloma. So it's very different now compared to 20 years ago. 20 years ago, we only had a very limited armamentarium of drugs to treat the myeloma, and these were basically chemotherapeutic agents and corticosteroids. But now we have many other agents that are many target therapies, immunomodulating agent, and immune therapy. So I would say that the most fascinating is the change in the treatment armamentarium and as a consequent, the improvement in the prognosis.
It is really very nice development of my benefit for the patients, but I'm sure there are still some challenges in the treatment, in the management of myeloma patients.
Yes, of course. The first challenge is where to start treatment. Usually, it was considered that myeloma patient should only be treated when they had already clinical symptoms. And sometimes it's too late because the initial symptoms may be a pathological fracture and an insufficiency. So it's a challenge to do the early diagnosis and early treatment. And there is a condition that is known as smoldering myeloma, in which the patient already has a malinfiltration. It has the production of the monoclonal component. It is sure that it will evolve sooner or later to a multiple symptomatic myeloma. And there are studies now that have allowed to identify high-risk smoldering or indolent myeloma, very high probability of transformation to multiple myeloma. High-risk smoldering myeloma, it has been shown that early treatment, basically with lenalidomide and dexamethasone, improves the prognosis and delays or even maybe avoids the development of symptomatic myeloma. So this is one important challenge, the early treatment. Another important challenge is how to evaluate the response to therapy. And as it is becoming more and more important to have very sensitive methods to assess measurable residual disease, also in myeloma patients. And we have more and more sophisticated tools to assess this MRD. And now it's possible also to apply next generation sequencing or next generation Creu, or even novel techniques as mass spectrometry to assess the response. And of course, the big challenge is how best to use the novel agents. So try to use them most effective upfront, because as in other hematological malignancies, if you want to prolong the survival or to cure the disease, very important to use the best agent upfront to get the longest period of progression-free survival. And we have now many different possibilities. For example, now the frontline therapy is with the proteasome inhibitors, is with immunomodulating agents, with dexamethasone, but also with monoclonal antibodies against CD38. And if you use these 4 drugs, then you get a very good response, and then progression to survival and overall survival. It is also challenging the use of autologous stem cell transplantation. There have been studies questioning whether autologous transplant is still necessary if the global agents era. And so far, autologous still remains a very important part of the treatment. So you should continue doing autologous transplant whenever possible. And also it's important after the transplant is made out there. And a final challenge in therapy of myeloma patients is implementation of immune therapies. So we know that there are targets in the myeloma cells that may be attacked with immunotherapy. We have, for example, BCMA, the CAM7, the CAM other targets, and we can attack them with monoclonal antibodies, with specific antibodies that attach to the targeted myeloma cells, but also to the T cells, and approach these T cells in order to a higher destruction of the neoplastic cells. And of course, a novel CAR T cell therapy also has been extended already to myeloma, and we have at least 2 BCMA autologous CAR T cell therapies which are already available, and may rescue patients who have failed to the phase to only under 2 years.
So based on the many developments in multiple myeloma, which is, I think, really impressive, but also on those still remaining challenges, what do you think would be interesting for students, medical students, or young hematologists in regard to multiple myeloma?
Well, there are several. As I would encourage to do, for example, research in the molecular events that lead to transformation from monoclonal gammopathies of not significant to a smoldering myeloma and to multiple myeloma. Also to look at the molecular events after response to therapy and in relapses, so that to investigate the clonal evolution of the disease. I would also encourage them to do studies on measurable residual disease, and I think that although the prognosis of these patients has improved, there is still a way to go, and to improve not only the length of survivals of these patients, but also the quality of life. Because in multiple myeloma, the multidisciplinary approach is very important to involve people from other specialties, radiology therapy, social workers, palliative care, psycho-oncologists. I think it is it's very important, the multidisciplinary approach in these patients. So it's a really, although we haven't proven there is really a way to go.
So there's lots of room for the young hematologists, for the medical students, if they are interested in doing research or also clinical research in multiple myeloma. And I think this measurement of residual disease is very, very, maybe it allows us to react very early and to preempt this therapy in these patients. So, maybe one last question. So, what I mean, you already mentioned the developments in therapy in multiple myeloma. What do you expect in the next 5 to 10 years? Do you think we can aim to cure multiple myeloma in the next 10 years, or where do we go?
Well, I think that we may be there if we are able to treat early the patients, as I mentioned in the small myeloma situation, but also when we are able to use the best therapies up front. And in these regards, for example, CAR T-cell therapy or the specific antibodies are being applied in quite late moments of the evolution of the disease. If you transfer this to a very upfront therapy, it is possible that you can cure patients from scratch, from the beginning, by using the novel agents followed by the best immune therapies, including capital therapies. So I think that moving up from not only in myeloma, but also in the lymphomas or acute leukemias, the best therapy that have been tested in advanced phases may lead to the cure of most patients with multiple myeloma, maybe in 10 or 15 years from now.
Yeah, it can be easily measured by the measurement of minimal residual disease. So that's really nice to monitor. And also maintenance, I think, will still be a big role in the treatment.
Sure. Of course, to do the early therapy of measurable residual disease is crucial. We transfer this to infectious disease, for example. If we monitor CNV now, which was in the past needing to fatal pneumonia, but now with monitoring CNV PCR, we are able to abort the development of the disease. So the same in tumors. So if you are able to treat very early measurable residual disease, for sure you will be able to cure most to the patient or to transform the disease in a chronic result.
Yeah. No, I think the developments in multiple myeloma treatments, the knowledge we gained over the last years, this is really very impressive. And the change in the combination of the therapy is what I think is really a challenge, but also very fascinating. It's a disease that needs multidisciplinary management of the patient. So this is something that I think is very fascinating and a challenge for us as hematologists. A final message from your side with regard to multiple myeloma?
Well, there is a final message for students. So I encourage you to become an oncohematologist with involvement in this disease or in other hematological malignancies, because hematology has always been at the forefront of information, diagnosis, and in therapy. This small by other specialties, for example, oncology. So I think hematology is fascinating, oncohematology is fascinating, and multiple myeloma is also a fascinating disease where we can improve a lot the length and of survival and the quality of life for our patients.
Thank you very much, Professor Sierra, for this interesting and informative interview. And thank you for listening.
Thank you. Can I ask you to ask one more question? I have one more question. You mentioned about asking students to get involved in more research, but my question would be, like, if they want to get involved in research, how would they do that? Is there a way they could do that easy? A preceptorship, perhaps? Is there? Yeah.
How can they?
Yeah, if they want. Yeah.
You want to record it?
Yes. That would be good.
So with regard to our students and the young hematologists, I mean, many of them are interested in doing research work. So with regard to multiple myeloma, how can they get involved in research?
Well, I think that the first is to choose the best place to do the research. not all the hematology departments are mainly focused on multiple myeloma. So if somebody wants to do research in multiple myeloma, they should go to the appropriate place, and they need to get the information of where this research is done on each country. But in all European countries, there are at least 2 or 3 centers which are focused on this disease and that have a lot of patients and in consequence, a lot of samples. This is number one. And then they have to get a good mentor. So the mentor is essential in order to work with him the research project they want to develop. And then they have to be very constant. I mean, they have to have a very clear ideas of what is the question they want to answer. And so the mentor, it is relevant in order that this question has not been answered before, and that it has novelty. And as I mentioned, it's very important to be very constant, very focused on what you want to do. So to do it at the best place and with a good, the best mentor you can get. And don't forget that the improvement in the clinical research are based on the improvement of more basic and translational research first. So although sometimes it's not so easy to see the applicability of one more basic research, at the very end, this will translate into improvement of the prognosis of the patients.
So it may be networking plays an important role, networking that you can learn or do within such a program like Lighting the Flame. So do you have contact to experts in the field? And maybe there are some programs or possibilities that these young people come to your lab if you are an expert in multiple myeloma, visit your lab, have a kind of preceptorship, and get some more information and might get interested and make a decision to come to your department.
Yeah, that's true. So I think that networking is essential. First, to know what to do with your professional career and your research career, but also when you are doing the studies, hematological malignancies are not so frequent and less frequent than solid tumors. So also networking when you are doing research, both basic and clinical, is mandatory because there are not so many patients and samples to study. So international collaboration is very important.